In this podcast, I want to talk about the difference between sales and education. I want to start with an example. During this COVID crisis, and this will be my first podcast and the hair podcast after the COVID crisis, going back to work. But I was doing a consultation with a gentleman for hair loss, and he was a 61-year-old gentleman that had white hair and some loss along the front of the scalp. And I think that if I showed you that photograph, you would probably think it just was male pattern baldness. In fact, he was wanting some propecia. He was interested in a hair transplant, possibly down the line. I looked at it, and the first thing I thought about was that he had some kind of issue with frontal fibrosing alopecia. The skin just didn't look quite right. And also, he had a little bit of thinning of the eyebrows, and his hairline wasn't just exactly like male pattern baldness, but it's because I've taken years of looking at hair. And I said, "Sir, do you have any burning sensation of your scalp?" He goes, "No." I said, "Okay." And I said, "Do you use a lot of sunscreens? Because sunscreens have been implicated in FFA, the scarring type of hair loss, which is not amenable to hair surgery and is not that responsive to medical therapy, except for steroid injections. And it really isn't a medical emergency that he needs to be seen by dermatologists and start getting injected." He goes, "Yeah, I use sunscreen all the time." So I said, "Oh, interesting. So you use sunscreens all the time. And do you don't have any burning sensation with?" "Oh, yeah, I get burning sensation all the time when I use sunscreens." I said, "Oh, wow." So I just asked him a few minutes ago, did he have any issues with burning? He said no. But then I delved deeper, and he said yes. So I'm not saying all sunscreens cause this condition, but it can. So my point of this entire thing was using this example is that oftentimes when you go to these sort of chain outfits for hair transplant, you meet with a salesman, they hard sell you a transplant, whether you need one or not, whether you should have one or not. And I would almost venture to say that if this gentleman went to one of these hair clinics where it's just like a chain, you meet with a salesperson, may not even see the doctor, may not even see the doctor on the day of the procedure, who knows, you're going to be sold the surgery. You're not going to be educated. And so there's a big difference between sales and education. In fact, about 80% of my patients that come in for consultation, I reject them for surgery because they're not safe candidates. And so this is something that I want you to understand, is that safety is such a huge priority, and that involves education. And education involves someone with an educated eye and with a background that understands the clinical issues that would preclude one from having a hair transplant. Not everyone is a candidate for a hair transplant. And it's important to talk about the safety considerations when you're thinking about a hair transplant. All these things are so very, very, very important before you just sign up and do a transplant. I'm not going to hard sell you, call you 5 times, give you a discount if you don't sign up. I'm booked out to November. And so right now, I don't want to sell you a surgery. I want to be able to educate you whether you're even a candidate to have a surgery. And that's what is so dangerous nowadays, is these people are just being sold a procedure. I had a gentleman just this last week that I did a consultation with. He had a transplant in India. His frontal hairline is in all different directions. He's got his hair shape, his hairline design is ridiculous. It looks like a female hairline. Actually, it doesn't look like a female hairline. It goes way past where a hairline should be. His backside has been completely taken away. There's no hair left. There's almost no way that I can truly fix this. These are the kind of things that I see day in, day out, and it's so disturbing. So the one thing that I want you to understand is during consultation with me is that you're going to get a very educated perspective of what's safe, what's appropriate for you, and it's not a sales pitch.